Ladies and gentlemen, welcome to this briefing on COVID-19. We appreciate our media partners being back with us. It's been a few weeks since we've been together to have this type of discussion. You'll remember it was a little over 3 weeks ago that we were last together talking about the spread of the virus, specifically the Delta variant, and what we were seeing. You'll remember at that time that we had representatives from the hospitals that were with us, and the focus of that event and of that discussion was around the hospitalizations that we were seeing in the state and the concern that we were seeing around those hospitalizations in a couple ways. One, of course, just the raw numbers of hospitalizations that were happening, but two, the reduced capacity that we have in our hospitals and in our ICUs compared to the surge during the winter months in December and January and February. Yeah, that is because we have fewer healthcare workers in our system right now, which meant that even though the same number of beds were technically still available, those were beds that would not be staffed, and so we had less capacity, which meant that even though we were not at the numbers of hospitalizations that we had seen last winter, there was an equivalency that we were reaching max capacity. And so, unfortunately, over those past 3+ weeks, the number of hospitalizations has continued to rise. Of course, the numbers of cases have continued to rise, and we find ourselves at the breaking point of our hospitalizations now. Like all of you, we're sad that we're here. We're disappointed that we're here. We wished we were not here. We don't have to be here, but we are here. And if there's any good news over the past 3.5 weeks, it's that we have seen more and more people getting vaccinated, and we know that vaccinations are the best way to prevent hospitalization, to prevent death. And we are encouraged by the numbers of people that have been vaccinated. However, we remain very discouraged by the large amounts of people who have not been vaccinated. And we will talk more about that shortly. We I want to underscore, and again, we have people here who will talk with us about their experience from our hospitals, talking about how full things are and how dire they are now. I want to deliver a message, though, to our healthcare workers. And that message is that we are grateful for your sacrifice and your service. And I'm sorry that you are going through this again. My heart breaks for you, for the difficulties that you are facing, for the long nights and the hopelessness as you continue to deliver the best and most professional care anywhere in the world, and especially to people who didn't take the opportunity to protect themselves, and how difficult that is for you. But please know how grateful we are for you, and you'll hear more about things we're doing to help slow the spread of the virus today. So now, again, I want to underscore what is happening in our hospitals. I think it's important that every Utahn understand the dire situation that our hospitals are in. For the first time in our state, during this pandemic, we actually had a moment where there were no ICU beds available in the state. On Friday evening, a rural hospital needed to transfer a patient in critical condition to a hospital with more advanced treatment capacities. They called 2 hospitals but were denied due to bed shortages. So they called the coordination team that helps find beds for patients. And this is something that we've really kind of pioneered here in Utah. We have an incredible team. Other states have copied what we're doing. This team works in collaboration to find beds across the state for patients. The coordination team gets together. It normally takes 15 to 30 minutes for them to find space for a patient. But after 20 minutes, one hospital said they could take this patient, but within 5 minutes, that space was gone. Another hospital offered space, but that was also taken up in about 5 minutes. And so, again, for the first time in this pandemic, since the pandemic began, there were zero ICU beds in Utah's referral hospitals at that time. So these are the hospitals that treat the most serious cases, not just COVID, but injuries, illnesses, accidents, which don't stop just because we have a pandemic. Eventually, a bed did open up at a metro area hospital. And fortunately, it only lasted a few hours. But with critical care, every minute is precious. Unfortunately, as hospitalizations continue to rise and cases continue to rise, this is going to become more and more frequent, and we're obviously not okay with this. No one is okay with this. So so today we're here. We have our experts from the health department who are here with us, as well as representatives from our hospitals who will talk to you. We will be delivering to the people of Utah, and especially to our elected leaders and legislators over the next several days and weeks. Even more data about what is happening. We need people to make the appropriate decisions in their lives to protect themselves, to protect their family members, and to help protect our communities. We need elected leaders also to understand what is happening on the ground and in schools and in their communities. Um, this week, I will be meeting with the legislator over the past legislature over the past 2 weeks. We have been meeting regularly with legislative leadership. I want to thank and commend the president of the Senate, Stuart Adams, and the Speaker of the House, Brad Wilson, who have just been incredible partners throughout this pandemic, but especially throughout this Delta wave, as we have been meeting and in constant communication with them. However, leadership is not the legislature, and the laws that we have in place now require collaboration with the legislature. They have the ability to overturn anything we do, and anything that is to happen beyond 30 days has to be approved uh, by a legislative committee and then by the entire legislature. It's been very difficult. It was easier back in January and February and March to have discussions regularly with the legislature because they were in session. It's difficult because they are not in session now and have not had their regular interim time during the months of July and August. And so we've asked, and the president and speaker have graciously accepted our request to be able to meet with the legislature. We will do that via their caucuses. So we will have separate meetings with the House Majority Caucus, the Senate Majority Caucus, as well as the House and Senate Minority Caucuses, in which we will present all of the data to them. We will have present with us our healthcare professionals to answer questions that they have, and then our hope is that we will be able to find some consensus on further measures as we move forward. So stay tuned for our report on those discussions. So just some more things that we want you to be able to know. By the way, we will also be delivering updated and additional information to elected leaders throughout the state, county officials. I think all of you know that right now, local health departments, as well in coordination with their county councils and county commissioners, also have the ability to implement public health orders. And so we will continue to make sure that we are pushing the data directly to them, as well as school officials and parents across the state. So we're going to share more of that data with you. We have updated our school dashboards, and there will be additional updates coming over the next few days. Again, we want parents students, teachers, elected officials, all to be able to make the best decisions for them, for their families, for their constituents. We will do that by presenting up-to-date information on every school in the state, showing the spread that is occurring in those schools. We're working on a color coding system as well. That's not available right now, but where we will show a school in green with less than 1% of the school population who with an active positive case, from 1 to 2%, a yellow cautionary that spread is occurring, and that cautions need to be taken, and then 2% and above. A red color code that shows that there is significant spread within a school. Our goals from the beginning have been to always not overwhelm our healthcare system, which we're dangerously close to doing, and to be able to keep kids in school. And those two goals must be at the forefront of everything that we do, everything the legislature does, everything that local health and local leaders do, as well as our school officials. Currently, we have 1.8 million Utahns who have at least one dose of the vaccine. We're, again, grateful for those numbers. We're excited about those numbers, but also disappointed because we know it's not enough. That means that we have 1.5 million Utahns who do not have the vaccine. Now, a very significant portion of those are young people who are not eligible for the vaccine. But for those who are eligible, we desperately need more people to get vaccinated. And so now I'm going to turn the time over to Dr. Hoffman, who will talk more about that situation in our schools. Following Dr. Hoffman, Mark Harrison with Intermountain Healthcare will come and share what they are seeing at Intermountain Healthcare. Following him, Chris Miller from Intermountain Primary Children's Hospital will come and speak to us. And then Lieutenant Governor Henderson will address us on test to stay. Again, I want to thank Mark and Chris for taking time to come and share with us. I haven't talked as much about pediatric beds. That will be discussed here. I will say this: while we know that young people are still incredibly resilient, and gratefully this virus does not impact them the same way it impacts adults, and especially older adults. As we see this significant spread, even a very low statistical number can result in a high number of hospitalizations because so many people have it. And also of concern is that we're having an unseasonable spike in RSV cases, which means that we have a large number of hospitalizations, pediatric hospitalizations that are happening from something other than COVID. But the reason that's significant, of course, is that those are hospital beds that won't be available for COVID patients as it starts to spread. So that is also of significant concern. I can just tell you, in my own family, there was a case of RSV where a relative of mine should have been hospitalized but was not because of a lack of pediatric beds. Now, fortunately, we were able to take oxygen home, and that family member is doing well now. But those are the types of concerns that we have. That again, every legislator needs to understand. That every public health official needs to understand. And so we're grateful for these experts who can talk about what they're seeing on the ground. So with that, I will turn the microphone over to Dr. Hoffman, who also has some slides to share with you. And I believe if you've not received them already, a copy of those slides will be given to members of the meeting. Dr. Hoffman.
Thank you, Governor. Good morning, and thank you everyone for being here. We're going to start with a quick data update, as we have done in previous reports. Our rolling 7-day average for positive cases is 1,263 cases per day. 1 month ago, it was 795 cases per day. We're seeing a great surge of our case counts for COVID-19. The rolling 7-day average percent positivity person over person is 15.1%. This is the same as 1 month ago. The rolling 7-day average percent positivity test over test is 10.8%, also similar to 1 month ago. We are in a sustained surge of cases that is at unsustainable levels. Moving to our data, we have new school data. Right now, cases among school-age children are about 3.5 times higher than what we saw at the beginning of the last school year. Our projections, based on current cases and potential case growth, show cases increasing dramatically over what was experienced. But even in the range is alarming, with between 25,000 and 63,000 cases in September. There are 3 reasons for this. We're starting at a higher level. We have the Delta variant, which is 5 times more transmissible than other variants, and we have almost no masks in schools this year. Also, right now, children aged 12 to 17 are eligible to receive the COVID-19 vaccine. As of August 30th, only 38.1% of Utah children ages 12 to 17 are fully vaccinated against COVID-19. No health district has more than 60% of this age group, and 4 health districts have less than 20% of children fully vaccinated. We know kids are very unlikely to get seriously ill, but the sheer amount of transmission turns that small percentage into a fairly large number of hospitalizations. We also know that kids are very good spreaders, and even if they don't get sick, they take their infection home to those who may be more vulnerable. Undoubtedly, some of them will develop serious disease, some will be hospitalized, and some will die. And it's too many for our situation right now with the hospitals. We're just adding straw to the back of the proverbial camel. Hospital and ICU occupancy specific to COVID-19 patients has dramatically increased since the beginning of the summer. The number of currently hospitalized COVID-19 patients has increased by 342% since June 1. The number of COVID-19 patients currently being cared for in ICUs has increased by 330% in that same time frame. With the beginning of the new school year, as the governor mentioned, we've added some important data features to the case counts on the website. When you visit coronavirus.utah.gov/case counts, you can now find the following information. Case counts by individual school. Right now, we're reporting total case count, and we're working to add a feature to highlight when schools are approaching or have surpassed 1% and 2% thresholds to trigger the test to stay events. We're also reporting monthly hospitalizations for school-aged children, 5 to 17. In addition, you can now find information about vaccination rates for children by health district. Finally, we've added information about multi-system inflammatory syndrome in children. While rare, this serious condition associated with COVID-19 occurs where multiple organ systems can become inflamed. Data only tells a part of the story. And for the rest of my time, I really want to focus on 3 areas that are near and dear to my own heart. The first is COVID-19 nursing home outbreaks. The second is the current hospital surge. And the third is a brewing pandemic within a pandemic, mental health impacts of COVID-19. I chose these areas because of deep personal connections to the Utahns affected, and because there is a common solution. We know what works to curb the spread of COVID-19. All Utahns need to get vaccinated as soon as they are eligible. And all Utahns need to begin wearing masks now to put a stop to this current surge overwhelming hospitals. Let's start with nursing home outbreaks. When the pandemic first hit, I was at the front line caring for children, disabled children in a nursing home. For the next year, I supported a dedicated team of health professionals trying to curb the spread of COVID-19. The work is not over. Nearly 1/3 of Utah's nursing homes are currently experiencing a COVID-19 outbreak. The number and size of nursing home outbreaks is directly tied to the number of cases in the community. This week, we learned of one of the latest outbreaks. 100% of the staff and residents in this nursing home were fully vaccinated, and 25% of the nursing home residents had breakthrough infections of COVID-19. One was hospitalized and one died. And that is an ongoing outbreak that will continue to evolve and challenge life for the workers in those nursing homes and the residents who are seriously harmed from this disease. Vulnerable elderly living in nursing homes don't have the same response to the vaccine as younger, healthier people. They are most protected by those around them who get vaccinated. Next is the current hospital surge. For 17 years, I worked as a pediatrician at Primary Children's Hospital. I know precisely what a surge feels like because RSV surged year after year like clockwork. Walk with me for a moment in the shoes of thousands of healthcare workers across Utah experiencing the current surge of COVID-19 and RSV. They care for patients in hallways and in closets turned into rooms. They spend hours to ensure a safe landing place for patients when scarce beds are so incredibly hard to find. They're beat down by complaints when care situations aren't ideal. They work long hours and it's demanding, with the stress and magnitude of the situation sometimes leading to missing important details that can harm patients. And they know now that much of this is preventable if people could simply get vaccinated and wear masks. Finally, let's spend a moment on the mental health toll of COVID-19. For this one, I'm here as a mother, a wife, a daughter, and a friend. Today, I'm here to say that our loved ones are getting hospitalized with mental health emergencies. I have one of those in my own family. I'm here to speak about things largely unspoken across Utah. COVID-19 is harming our children and families in more ways than we know. The path to healing is the end of this pandemic, and it hasn't ended yet, even if we want to pretend it has. There will be deep and enduring harms to our children and generations to come if we do not stop the divisiveness around the things we know work, like masks and vaccines. I stand with you, and I'm truly sorry for the pain this pandemic has caused you and your families. We need to heal together. In recent months, our freedom to move about the community and forego masks and not take the opportunity to get vaccinated has come to the expense of the backbreaking work of everyone who has been at the front line of this pandemic: healthcare workers, public health professionals, teachers, and many others across Utahns. They have been at this for 18 months without an end in sight. They feel abandoned, and in turn, many are abandoning their true callings. The healthcare workforce shortages are real and escalating. All of us will pay the price for this. I want to extend my heartfelt thanks to each and every health professional, every public health employee, all essential workers, teachers, all parents and families, and all of our leaders trying to navigate this pandemic. But my thanks will never be enough. You need to thank them too. The single biggest thing you can do now to express your gratitude is to mask up to stop the spread of COVID-19. And after you've put on your mask, get vaccinated if you haven't already done so. Thank you.
Hi, folks. I'm Mark Harrison. I'm President and CEO of Intermountain Healthcare. I just took off an N95. I have an incurable blood cancer called multiple myeloma. And I'm post bone marrow transplant and an experimental therapy called CAR T therapy. And I'm in remission right now. But I'm also profoundly immunodeficient. I'm here today. I would normally avoid a group like this, but I'm here today because what we're talking about is so important. By the way, I hope that all of you who aren't wearing masks aren't carrying the Delta variant, because if you are, you could kill me. This is serious stuff. I'm here representing the 45,000 caregivers at Intermountain Healthcare and all healthcare workers across our country who are fighting a valiant fight in the face of this pandemic. I'm very appreciative for the governor for bringing this group together. we can make a difference together, but it has to be a concerted effort. Let me tell you what is going on in the Intermountain system this morning, and it is comparable to what's happening in the other three systems here in Utah. I will say that we have a fantastic relationship with the University of Utah, Steward, and HCA, and as the governor shared, incredible collaboration has occurred over the last year. Competitors are really working as colleagues, and it's heartening. Unfortunately, right now, it's not enough. So our ICUs at Intermountain Healthcare, the referral ICUs, the big ones, are at 103% of capacity. Our ICUs as a whole are at 100.5% of capacity. We have had more life flight transfers in the last month than we've ever had before. And 300 times we've needed to transfer patients from between healthcare systems. And we're happy to do that. It's bad for patients, though. It's good for them to get a bed, but yet an extra ambulance ride or helicopter ride increases the complexity of their care and the risk to them. This is not ideal. We are hearing and seeing enormous stresses, particularly from smaller and rural hospitals, because of their inability to move patients fluidly. I want to make it really clear that while COVID is exacerbating things, there's other care that needs to go on. So normally we would run our ICUs at about 75% capacity. What that means is if somebody gets in a car wreck, if somebody has a heart attack, if somebody has a stroke, if somebody needs emergency heart surgery, we can fluidly move patients in and out of those units. That's not the way it is right now. In fact, we are delaying elective cases right now. Now, that may not seem like a big deal to you, but let's say you've had incredible back pain for months and months, and you've been looking forward to the opportunity to get that solved. You may be delayed. Let's say your heart surgery could maybe wait another month, maybe not. You may wait. We are providing less optimal care than we would like because of the capacity constraints caused by the 30 to 40% of ICU beds that are taken up by COVID patients. We are happy to care for everybody, but it's extraordinarily difficult for our caregivers to manage this extra surge. I will tell you that, like the rest of the country, we have lost some really valuable clinicians over the past year. Some people just can't take it anymore. It has been unrelenting, the stresses that these folks have faced, and they are particularly disheartened by the amount of unnecessary death and destruction that they are seeing. So let me be very specific here. You heard that we have about 1.7 million vaccines that have been administered here in the state of Utah. I think we're close, Dr. Hoffman, to about 3,000 Utahns have died. Is that about right? There has been 0 deaths from vaccination. 3,000, 0. People who are vaccinated can get breakthrough infections, as you heard. It's still extremely rare. They still can die. It's actually people like me, the old, the immunodeficient, the people with multiple medical problems, heart failure, asthma, diabetes, obesity, etc. Those are the people who die when they have a breakthrough infection. That said, I'm going to actually call on a friend here. Eddie, there are fewer than 50 people with breakthrough infections who've died. Is that correct? 3,050. In our ICUs right now, more than 90% of the people who are in there are unvaccinated. It's vanishingly rare for vaccinated people to end up on a ventilator. If they even end up in the hospital, it's unusual for them to end up in the ICU. If they end up in the ICU, it's vanishingly rare for them to end up on a ventilator, and they virtually never die. That is not true for the unvaccinated. So I visited one of our ICU. I've been in 3 of our ICUs, emergency departments, and wards in the last week. I visited one of them at the end of a shift in the evening, and my nursing colleagues were distraught. They had had a previously healthy 40-year-old and a previously healthy 50-year-old die in the past shift of COVID-19. Their families were beside themselves, and they were confused and angry because they hadn't really realized how serious an illness this is. Those families, along with 2,998 other families, are changed forever by these deaths. That doesn't even account for the folks who are long haulers, who have multiple complications and comorbidities from living through the pandemic. And physical trauma aside, the mental pressure and trauma that they've faced. As Dr. Hoffman said, the behavioral health crisis, both for patients and for caregivers, is beyond belief. When I asked our nurses what they wanted me to do, they said, Mark, I don't think you can do anything except we would really like for people to realize what we're doing. We'd like for them to tell us, just like they did at the beginning of the pandemic, that we are heroes, that we're going above and beyond. They said, I wish people would understand that what we're seeing is preventable. Now, some of you might say to yourselves, well, when you sign up to be an ICU doctor like me, by the way, I spent 20 years doing pediatric critical care at the bedside, or an ICU nurse like them, you kind of sign up for death and destruction. Well, to some extent, that's true, but most of that is not preventable. So over the weekend, we had 5 more Utah families lose a loved one. My guess is based on statistics that every single one of those was a preventable death. And the trauma that these families and the caregivers are experiencing is very difficult, and it's demoralizing. When you work in an intensive care unit and you lose a patient, it takes a little bit out of your emotional bank account. A little bit of capital is withdrawn. Now, we usually get it replenished by big saves that we make, by helping families through extraordinary circumstances and helping patients survive. Right now, the balance is out of kilter. The withdrawals are far exceeding the deposits. And this is a tragedy. I will remind you one more time that stress and that damage that is being done to our healthcare system affects even folks who don't have COVID. Get hit by a car, fall off your bike, have a heart attack, get cancer like me. Every single one of us rely on a high functioning healthcare system. Utah has one of the very best in the country. Intermountain is world renowned for quality and for affordability and for keeping people well. And my folks are frustrated because their ability to do that is diminished by individuals who are choosing not to get vaccinated. And in this case, not to wear masks in the context of the COVID-19 surge. So here are the asks for you. The asks are for you to stamp out disinformation. The ask for you to personally get vaccinated and encourage your friends to do so. The ask for you is to wear a mask. And the ask for you, most importantly, I bet each and every one of you know multiple people who work in the healthcare field. Put your virtual arms around them. Provide them with support. Tell them they're heroes. Tell them that you appreciate their sacrifice. Ask them how you can help them heal their inner wounds that they are suffering from absorbing other people's misery and suffering. I'd like to thank the governor and the lieutenant governor for having me here today. And I too would like to express my admiration for our legislative leadership. President Adams and Speaker Wilson, I know how much they care as well, and it's a privilege to work in concert with them. God bless our healthcare workers.
Thank you, Governor Cox, and everyone here for giving us the opportunity to talk about children today and the COVID pandemic. In May, Primary Children's Hospital averaged 0 patients in the hospital with COVID-19. 3 weeks ago, with the start of the school season, we started to see an average of 3 to 4 patients every day in the hospital for COVID-19. And just last week, that average jumped to 7 to 9 patients on any given day. With over the weekend, at one point, we had 10 patients in the hospital for the undergoing care for COVID-19. This is near the max census that we saw last year during the school season. So combined with other Intermountain hospitals in Utah, we are now treating between 12 to 17 children on any given day in one of our hospitals, with 5 to 7 of those children being in one of our ICUs on any given day. Intermountain Hospital and Clinics over this past week has treated anywhere between 31 and 52 children for COVID across the system. So not only are we also seeing acute COVID-19, we're also seeing the multisystem inflammatory syndrome in children, otherwise known as MISC. At this point, we've cared for almost 100 patients with this syndrome that causes severe inflammation in a child's body, including their heart and lungs. As we speak, we are currently taking care of several patients up at Primary Children's with MISC. As Governor Cox mentioned, in addition to acute COVID, we're also seeing the number of respiratory syncytial virus cases, or otherwise known as RSV, also steadily increasing over the last 10 weeks. Normally, this is a virus that we only see in the winter months. Just this last week, we are now averaging 209 cases per week, which is rapidly approaching our usual peaks that we see in prior seasons. So again, we're also, in addition to COVID-19, we're seeing RSV and other respiratory illnesses quickly creep up. Finally, over the last few weeks, Primary Children's Hospital has been at or near full capacity due to a recent flooding on August 1st, as well as ongoing construction and the rising cases of RSV, COVID, and traumas within the community. So with a full hospital, increasing COVID-19 cases and RSV cases, our caregivers find themselves in an unnerving situation as we expect the numbers to continue to go up with limited capacity to care for those children. So we are all asking in pediatrics to protect those patients from COVID-19 who are not able to get the vaccine and also are not able to get the monoclonal antibody therapy, as well as from our other respiratory viruses such as RSV, to use universal masking, social distancing, and all those who are eligible to be vaccinated to get vaccinated as soon as possible. This is incredibly critical to make sure that we have the necessary resources to care for Utah's children. Thank you.
I want to thank everybody who's presented today. This is really important information, powerful information, and I hope people of the state of Utah are listening. I have a fairly brief message that I want to share today. I want to talk about a couple of tools that we have in our tool belt already that we can use in schools. We just heard some pretty dire statistics, some pretty potentially devastating information about how full our hospitals already are, about the real serious condition that we're in right now as a state as we face this pandemic, this new surge in this pandemic once again. And over the past few weeks, Governor Cox and I have worked very closely with legislators, with local health departments, with superintendents and others. And it's very clear that there's little appetite for any kind of statewide mandates other than what are already in place at this point. And it's frustrating for us. It's incredibly frustrating for us. However, today I want to talk about some of the things that are already in place and reiterate a few of those and make sure that people understand especially in schools, what our current tools are and what they should be doing. There are two goals that we primarily have when it comes to school-aged children right now. That is, number one, keep kids in school. Keep kids in school and do not disrupt their learning. And number two, protect the healthcare system. Keep our pediatric beds from overflowing, which, as we've heard, they're already struggling with. And as we face a new school year with fewer protections in place, fewer restrictions or fewer requirements in place, and a more transmissible virus, we're a little bit worried. We're really worried. But there are a couple of things I want to talk about. The first one is masks in schools. We already have delivered over 1.2 million masks, high quality masks, to schools throughout the state. We've got another 750,000 or so on their way. And those are available to any child who wants one, or any parent who wants their child to have one. Also available to school employees, teachers, and staff. The second thing I want to talk about is this Test to Stay program. It's been mentioned a little bit here. But one of the things that we have in place is what's called Test to Stay. It was in place last year. There's been some changes made to it. And what that means is when a school gets to a certain threshold of transmission of positive COVID cases in their school, and that threshold is 2%, that initiates the Test to Stay program. And that requires that students have a negative COVID-19 test in order to return to in-person learning. I want to restate that. That requires students to have a negative COVID-19 test in order to return to in-person learning. So while we believe wholeheartedly in parent choice, we know that parents are responsible for their children. As a mother, I believe that as well. We also believe that choices have consequences. And if a parent chooses not to let their child be tested for COVID-19, if that 2% threshold has been met in their school, that parent is also choosing remote learning for their child. This is a very important message that needs to get out there to parents, needs to get out there to school districts, it needs to get out there to local health departments. No additional mandate is needed. This is state law. This is not me talking. It's not the governor talking. It's not local health departments or school districts talking. This is state law, current law. If your school trips that 2% threshold, your child has to have a negative test to return to in-person learning. I really want to thank our public health officials in closing. It's been an incredibly difficult year and a half, more than a year and a half. And they've taken a lot of heat. They've taken a lot of pressure. And like our healthcare workers in clinic and hospital settings, our public healthcare workers have had a heavy burden, and they've been demoralized. I want to thank them personally, and I know that they have the thanks and the gratitude of everybody throughout the state. Keep up the good work, my friends in public health. Keep up the good work, my friends in healthcare. And our school districts, our superintendents, our principals, our teachers, thank you for what you're doing. Please continue fighting this fight so that we can keep kids in school. We can have fewer disruptions to learning, and we can protect our healthcare system, especially our pediatric hospital beds. Thank you very much.
Thank you, Lieutenant Governor. Thank you to our medical professionals, our public health professionals who were willing to spend time with us today. I just want to say one last word, and then we're happy to open it up for questions. It's been well documented how much I hate masks, and how I think I'm not alone in that for sure. I've been fully vaccinated. That has also been well documented. as Dr. Harrison mentioned, we do have big breakthrough cases, and I think it's important to talk just a little bit about that. The whole purpose of a vaccine and understanding, and of course I'm not a medical doctor, but the purpose of a vaccine again is to build up an immune response so that when we are exposed to the virus, our bodies have the ability to fight that virus off. So that doesn't mean that we never get the virus. That's never been the purpose of a vaccine. It means if you do get the virus, then you're able to fight that off, which means that there are likely lots of people who have been exposed to the virus and who have had the virus and never showed any symptoms because the vaccine did exactly what it was supposed to do. So that's the purpose of the vaccine, to fight off the virus. And so we do sometimes see mild illness, as was mentioned. Sometimes we see more serious illness, especially amongst immunocompromised and the elderly. And but those instances are so rare. That being said, I'm as much as I dislike it, I'm going to try to, especially when I'm around unvaccinated people and immunocompromised people, I'm going to try to wear a mask more often. We went to church last Sunday, as my family did, and because we were asked to do that, and we're going to try to do that. Now, there will be times when I don't have a mask on, and someone will take a picture of me, and some of you will lose your minds, and that's okay. But just know I'm going to try a little bit harder so that I can protect people like Dr. Harrison and others who are immunocompromised or struggling, and even those who have chosen not to get a vaccine, because I love you and we need you around to be a great part of this state. With that, we're happy to answer questions, and I'm sure you have a few, Ben.
Governor, at this point, what public health measures are you contemplating? Because you said you're going to be meeting with legislative leaders. These are bills you signed into law that allowed for this to happen.
Sure.
So what are you going to do about it now that you have cases serving?
Yeah, so I think it's important to note, then, that circumstances were very different when these bills were passed. When these bills were passed, the cases were going down and vaccinations were going up, and the Delta variant wasn't a thing. And so we were told at the time, we were assured at the time, we were promised at the time, and you'll remember we weren't happy with the bills. We negotiated some compromises with those bills and felt an obligation to sign. That being said, we did support where we ended up, but we were always told and we were always promised that if things changed, that the legislature would be willing to revisit that by taking on a greater level of authority over the pandemic response. We were assured, and you can go back and check the receipts on this one. We talked about it often. That we were assured that if things changed, that they would be willing to reconsider and make decisions based on those changes. And so things have changed. We have a new variant. This variant is very virulent. It's very contagious. While we're seeing vaccines go up, they're going up slower. And of course, we're seeing these mass hospitalizations. And as you saw, the cases are very different in schools. And so we have to. I also think it's important, and I mentioned this before, but we have to get their support. There's very little choice other than to get their support if we're going to move forward on anything. So we're open to ideas. We know they've rejected some of ours, and so I'm anxious to hear some of theirs. We'll be talking again specifically about schools and the broader public. Also other things. I think it's important to bring up. We're not so look. You've heard the asks from all of us, from Dr. Harrison specifically, that we need people to get vaccinated. We need people to wear masks. We need people to thank our healthcare workers and to do everything possible to keep them to keep them from having more work than they have now. But we're looking at other avenues to treat this as well. You heard monoclonal antibodies as one option. We have been using the monoclonal antibodies here in the state of Utah, but we're we're talking about some novel approaches, ways that we can significantly expand that approach to, again, alleviate what's happening in our hospitals. Monoclonal antibodies are not a replacement for vaccinations. They're not. But we also know that the vaccinations alone right now they aren't going to get us through this immediate momentous surge right now. Although everyone should absolutely get vaccinated, we need to try to relieve the pressure. One way we can do that is through more monoclonal antibody treatments, and so we're looking at ways to expand there. So again, every idea is on the table, but we have to have the full legislature engaged. Please.
Hi, Governor Cox. I'd just like to get some clarity on what mask guidance you're specifically putting forth. I know you yourself have just said you're going to try to wear masks more often when you're in front of unvaccinated people or immunocompromised. And yet we have our hospital leaders calling for universal masking. And even half the people in this room right now aren't wearing masks. So I'm a little bit confused what message you're trying to put forth right now.
Yeah, we are encouraging people to wear masks. Look, there is no way the legislature is going to approve a mask mandate for the state. They've made that very, very clear. And so the question is, what are things that they're willing to do? And so we'll be having those discussions. One of the proposals that was put forward was it was not a school mask mandate, but a limited opportunity for schools to require masks after there was significant spread. Once we started to see that, and for a limited amount of time, so you would have a threshold. If spread got above that threshold, they could bring masks in and until it got below that threshold, and then the mask would go away. So not a universal mask mandate. It would only apply to schools where they had over the threshold, and it would go away immediately under the threshold. That was one of the discussion items that was put forward. Look, I also want to be clear, and this is, again, the mask thing is so blown out of proportion. Let me just say this: masks are not as effective as most of the pro-mask crowd are arguing. We know that they're just not. They are a tool, and they do have some impact. We know that. There are lots of studies. Some of them show impact a little higher. Some of them show negligible impact. Very little studies done on masking in schools with the Delta variant. But we know it's a tool. So we know it does something. Probably not nearly as much as people think. And we're about to find out, because we do have some mask mandates in this state, right? We have mask mandates in Grand County. We have a mask mandate in Salt Lake City, the largest municipality in the state. We have a hybrid mandate in Summit County, which is very, very much like the idea that was put forward over a threshold. And so, we're about to see if the number of spread in those schools with mask mandate is marginally different. We also do have kids wearing masks. In my daughter's school, probably a third of the kids are wearing masks, and many of those kids many of the kids not wearing masks are vaccinated. So masks are not going to completely solve all of this. I know there are a lot of people that think if only we had a mask mandate, the Delta variant would disappear. There are lots of states with mandates, and their numbers are skyrocketing too. So let's get over the fact that masks are not going to single-handedly solve this crisis. At the same time, masks are not the evil that others have portrayed them to be. For most people, masks are an inconvenience at worst. There are some, and again, especially the very young, where I do have deep concerns. And despite what a few Twitter warriors say, I have talked to dozens of kindergarten and first grade teachers who are deeply concerned about kids' abilities to read and their speech and their mental development. There are reasons that some countries that are very pro-mask are not requiring masks for unvaccinated young people, because that is real. And so the anti-maskers and the extreme maskers, we just need to get over ourselves a little bit and try to have a little bit of common sense here. Unfortunately, that's what's missing from all of this discussion, is a little bit of common sense, a little bit of nuance, a little bit of grace, and a little bit of understanding. And that's what we're going to try to bring to the legislature. Other questions? All right, seeing none.
At this point,
Go ahead,
Governor,
then we'll go there. Yeah, go ahead. Let's go here if that's
sure.
okay. Yeah. Please.
So we know that the answer is vaccine.
Yeah.
And we've been asking nicely, we've been asking nicely. But that's not working, it seems like. So what is the next step? What is the stick versus the carrot approach? Is there one?
Well, again, that's up to to leadership. I don't. There isn't a huge appetite, and me included, for overarching public vaccination mandates. Um, but there are consequences for not getting vaccinated. As we talked about it, the last time we had one of these, we've encouraged the private sector to get involved. And by the way, there should also be a carrot approach. We appreciate we do have some insurance companies that are offering offering incentives for people to get vaccinated. We certainly support that. We support private industry who are making those decisions to require vaccinations. We expect that there will be changes in to health insurers. And by the way, health insurance does this all the time, right? If you're a smoker, you pay more for your health insurance. If the average hospitalization for COVID is north of $50,000. And so a free vaccine versus $50,000, that's a pretty easy choice. And the market is going to start demanding more and more of that. And so that's going to happen. We do have on the books, and you saw we had a joint statement from the speaker, the president, and myself, a requirement for most of our universities now for vaccinations. There are exceptions in there that people can claim those exceptions, but we did see a significant increase in vaccinations at Weber State University. I know they saw their biggest day ever at their clinics when that requirement went out. And so again, I am heartened by the significant increase that we've seen in vaccinations over the past 4 weeks. That's really good news. But we do need young people to get vaccinated, again, to slow the spread, and especially the most vulnerable. So we'll see those numbers go up, but we will be having those discussions as well. How can we get vaccines more available? How can we reach people that are seriously struggling with this? Where we have seen the most willingness to get vaccinated is when doctors are having conversations one-on-one with patients who are skeptical of the vaccine. But that takes time, right? Mass vaccination clinics, we can vaccinate thousands of people a day. Meeting with your doctor, it's one-on-one, half hour more. That takes time and it's slower. But we are making progress, and I so appreciate everyone who's changed their mind. Again, when you have 30,000 people a week now getting vaccinated, when we've gotten down to about 19,000 or 17,000 a week, those are people changing their minds. And that's a big deal. To have 30,000 people a week change their mind on this, that's hopeful, and we're optimistic. Now, one more question, please.
Governor, you have on here in Dr. Hoffman's presentation the metrics that were in place for HB 294, and the two of the three major metrics have now gone back the other way.
Yeah.
Does that indicate that maybe some of the authority and power that was given over to the legislature needs to be clawed back to the executive and to the health department?
Well, it doesn't mean it needs to be clawed back, but it means that the legislature needs to engage. Again, those were the metrics that they put in place for us to end where we were. Now we've gone back above those,
And that's not a two-way door.
It's not a two-way door, no, but it certainly opens the door for a new discussion and a new consideration, and that's why we're engaging with them this week, is so that they can, again, outside of leadership, so that the entire legislative body can really deliberate and talk, although it has to be in caucuses because they're not in session, but at least they can start to have these conversations, understanding the data from when they passed that bill and how different we are now, up above where those lines that they put in place. And by the way, they wanted those lines even higher, and we're above where even those initial proposals were. So we negotiated down to that point.
Considering that the legislature can't move as quickly as the executive.
Sure. Yeah. Look, I have said this from the beginning. Our form of government isn't great for pandemic response. It's just not. But it's an incredible form of government. I believe in it. I sustain it wholeheartedly. The legislature had given the executive a power. It is their power. It's not mine. Under the Constitution, that power is not in the executive branch. It has to be given by the legislative branch. They gave that power. And they decided to change that balance and pull some of that back. And so we will work with them. We have to work with them. And it's just good policy. I mean, if I'm being perfectly honest, one of the reasons we got to that part is we probably didn't work with them closely enough in the beginning of the pandemic. Maybe if we had done a better job of engaging directly with them on more of the big decisions, but it was so chaotic and things were moving so quickly that we did the best we could under those circumstances. And but now circumstances have changed, and it's time to reengage.
What's the point where it's going to go from caucus meetings to?
Well, so I again, I don't know if we have to have a willingness to do that. That's when it changes. If there's a willingness to act, if there is, and we don't need unanimity, that's not what we're seeking at all. But if there's a consensus that there are changes that can be made that they're willing to support, then we would call a special session and have them come in and make those changes. If there's not, then it is what it is, and we use the tools we have and do everything we can to keep people safe. And that's where our plea to public good. It's also important to point out that if you look at the history of the pandemic, states with very, very authoritarian mandates and states with very little mandates or none at all. If you look at the mobility data and the actions of people, they were very similar. Regardless, people made their decisions based on the information they were given and what was happening there. I think vaccines are a great example of that. Vaccines were waning as soon as cases started to go up. People started getting vaccines. We didn't add any mandates. We didn't change anything, but they were able to make good decisions. And so our hope is that as if the legislature is, if there's nothing more that they will do, and I hope that's not the case, but we'll know soon, that people will make different decisions, and that we can collectively work together to bring down those case numbers. Ben, you had a follow-up question, and I'm out of time, but I owe you that one.
At this point, if you don't get anywhere with the legislature and you don't get anywhere with increased vaccinations, is there any metrics for herd immunity, natural immunity, anything like
Yeah,
that?
so we continue to look at those, and we're learning from other countries, we're learning from other states what that means. Some of the data that is coming out, we haven't talked much about it, but we do know now that the most recent studies have shown that there is significant immunity that is conferred from actually having the virus, right? And we still don't know how long that immunity lasts. We know that those studies also show that getting vaccinated on top of having the disease confers even more immunity. That's even better. So we still encourage everyone to get vaccinated. But it is good news that having COVID before confers significant immunity. It's hard to know then, because there are lots of people who have had COVID that never got tested. So we don't know. There's some smaller studies that have been done, some hypotheticals that we can run about kind of where we are with people vaccinated, not vaccinated that have had the virus, and then people that have had both the virus and the vaccine. And so we're kind of running some numbers to figure out what that is, but nobody knows exactly where we hit herd immunity. And again, the Delta variant throws a wrench into that as well, because it's more contagious and probably more likely to have breakthrough cases as there's community spread. But we are seeing cases start to turn around in places like Florida, places like Arkansas, places like Louisiana, where their cases were astronomically higher. So just to put it into perspective, in Utah right now, we're at about, I think the latest, we're probably about 38 cases per 100,000 in the state. And Louisiana and Florida and some of those places were well over 100 cases per 100,000. So we're talking 3 times the number of cases per capita that we have here in Utah. So of course we never want to get to those levels, and hoping that that's not what it takes to turn this around. But we have higher vaccination rates than those. We're a younger population than those areas, and so we're very hopeful that plateau and turn will happen soon. But what we've thrown into this mix is schools, right? And so now with schools back in session, as you saw the data today, the opportunity for greater spread at a time when maybe we're starting to reach the top of that curve and potentially plateauing, but you interject this kids going back to school, and the potential for that growth to continue for some time certainly remains. And with that, again, we want to thank all of you. To our friends at home, thank you for your willingness to step up, to make changes, to be more careful through this surge that we're having right now. And let's remember to reach out and thank our healthcare workers. And the best way you can thank them is by getting vaccinated and by being careful and by wearing a mask and not spreading this virus. Thank you so much.